Hello, my name is Amos Nungu, and I'm the head of the Center of Excellence in ICT here at TDIT Tanzania, but also a researcher, a lecturer, and a consultant at the Institute. And we are working with partners on this very project. We call it the Community Health Portal, and then now it has been changed to the National Health Portal. And why the project? Previously, I have been sponsored through SIDA, Swedish International Development Agency, to implement a project in the Bunda and Serengeti areas known as ICT for Rural Development. And through this project, I've been working with SPIDA, where I've received more than 2 ICT interns to provide support to the local communities in the area of ICT. So now this project, Community Health Portal, it was an add-on to the ICT for R&D project, trying to provide services with the infrastructure already built. And the main idea was trying to make health information easily available and accessible to the healthcares working in the rural and remote areas. When we started the project, we are collaborating with the Muhimbili University School of Hygiene in Tanzania and the Karolinska Institute in Sweden, who are working on the medical aspect, but also on the technology aspect. It was us at CDIT and the KTH, which is Royal Institute of Technology in Sweden. Of course, KTH and DIT have been working for a long time, especially in the ICT for Rural Development project. This was a 2-year project. So after 1 year, then we started to think critically on the long-term sustainability of the project. And we realized that we need the government, the Ministry of Health and Social Welfare to be a collaborator in the project. So we approached the education unit so that we can work together, and especially since we are creating a platform to make information easily available and accessible to workers. So we thought the communication unit was the right player to work with. And through them, then we get engaged with the whole government, especially with the ICT unit. And our intention of trying to bring in the ministry comes to the sustainability, long-term sustainability of the project. Because our idea was understanding that we as technologists or our collaborators who are specialists in the health area, but we don't have the final authority on what kind of information to present or disseminate and what not. But if we're working with the ministry, then whatever we are deciding to present to the community, then it has already the blessing of the ministry. That was the first thing. And also at the same time, we thought, the ownership, because if the ministry is somehow involved in the project, then we are sure of the ownership process, and also at the same time, trying to streamline resources, because when another project is coming up, and they have the same idea, then it is easier for the ministry to guide them that why can't you collaborate all together with the already existing project instead of starting a new one. So in that respect, we believe that the project will exist beyond the inception now. And we know, because we've been working together with the ministry now, that it has many plans related to the portal. They are looking for funds or other resources in order to realize whatever they are thinking about. So working together with the ministry and the other partners, including SPIDA, of course, who has sponsored this initial phase, we believe that we can reach the majority of the healthcare workers in Tanzania. Thank you.
My name is Daudi Mboma, and I'm a project manager for the Community Health Portal project. So initially, Community Health Portal project, we looked at developing a portal whereby we thought of providing information to end users. I mean, we focused on rural parts of Tanzania, that is Bunda and Serengeti district. That was original idea of the Community Health Portal. And the proposal was to cover like two aspects. First is to get information to the end users. For this we target, as we say community, we targeted health workers together with the normal citizens at large in the rural areas. But during the course of implementation of the project, it was noticed that this information could be of importance not only to the rural parts of Tanzania, but to the nation at all. So the project somehow got twisted, and we could not only cover the rural part, but we later on twisted the project to become the National Healthcare Portal. So now the portal is accessible in the internet and can be accessible everywhere in the world as long as somebody has connectivity. Now, during the implementation, the project has two parts. First, we have the informative, or what we call the informative portal, whereby we have uploaded all necessary health-related information. And this part, which is available at healthportal.or.tz, this part could be of importance to the general users in general, like the normal citizens, and also to some health professionals. But we also deployed an e-learning platform using an open source technology called Moodle, whereby health professionals, even the general public, can get access to different e-learning courses, which the courses were developed together with other stakeholders, and the courses were tested, and now we have developed already 6 courses are online, and furthermore courses are being developed to be uploaded. These courses will be available for the next 1 year. We are not going to close them, and they are freely accessible. When a user visited the e-learning platform, which is available at ehealth.ditnet.ac.tz, a user is just required to create his or her own account to the portal. Once the user creates his username and account in the portal, an email will be sent to his email so that it can be verified, and from there onwards the user can enroll in different courses and can access different materials. All technologies that we used in the implementation of the project are open source. Together with an e-learning platform, the Moodle, we also developed we also deployed a smart class application whereby a teacher or someone who gives out the course can easily instruct to the students, and it can virtually create an environment of a real classroom. So those are the main technologies that we deployed for the National Healthcare Portal.
Hey, my name is Declan Pai. I'm a student at Albert Kairuki Memorial, and I use that on Health Portal platform. And mainly e-learning. E-learning has been very usable and interesting, and actually to me, the same to you, because it helps you to self-study different causes and diseases, especially non-communicable diseases and communicable diseases, and diseases that are very important to know, like Ebola, which is the burning issue now. Furthermore, it helps also health workers by updating them on different causes of diseases and I'm sure you're going to have a nice time accessing on it because it's there 24/7 and very flexible, and you can use it anywhere. And I would wish you to be one of the participants, and you're mostly welcome, and I'm sure you're going to be knowledgeable. Wish more courses to be added so as it can increase the number of participants interested. Thank you.
My name is Peter Bunda. I am a student at Albert Kairuki Memorial University. Health portal, especially e-learning, I would like to speak about how the information are arranged in the program. This will help me to download and to read the information about the disease in a particular space, a particular time. Also, about smart class, what I would like to say is what interests me in smart class does not need physical attendance, so that I can learn anything about the course to any place I am, does not bound me to the time, place. So this one will give me opportunity to learn more with lower cost. I encourage this course should be provided continually.
Hello, my name is Teofil Rodovic. I'm a medical student at International Medical and Technological University, and also I'm a user at e-learning platform. E-learning platform which provides a clear interaction between students, health workers, and all medical personnel who are involved in providing health care to the community. The program is very exciting as it involves all the counterparts. There is direct interaction between the lecturers or the teacher, the students who are in the e-learning, and you can also have a great time to discuss various issues relating to topics which are on the platform. Also, you can have the clear interaction between you as a student, for example myself, and also with the other students or health workers from anywhere who are also enrolled in this course, with direct interaction, chatting, discussing, and give us updates about diseases. I also interested more about the smart class, which is the virtual class about the disease. As the teacher provided knowledge directly as in a normal class, and also it is more exciting as the program itself. Give you the global opportunity to expand your knowledge, to get updated, and furthermore to upgrade your professional development. I encourage this program to be widely used, and for all those who are creators and supporters of this program to support more. It's an exciting, and it will be the awareness for this should be spread to all the health centers and health workers and all the personnel who are responsible for this provision of health.
Naitwa Maneno Hamisi, mkazi wa Kibabwani. Nimeiona poto katika mtandao na nimekuta ripoti mbalimbali zilizowekwa ambazo sikuwahi kuziona. Pia nimeiona video ya Ebola na nimeweza kujiandikisha katika kozi ya malaria. Pia naomba waendelee kuweka kozi kama hizi. Kozi zinaelimisha jamii. Pia ningependa kozi hizi ziwekwe kwa lugha ya Kiswahili. Na natoa pongezi kwa Wizara ya Afya na DIT kwa juhudi zao kutengeneza tovuti ya poto.